Hey guys, I would like to talk about the current state of medicinal applications of nanotechnology. And this is a particularly interesting time for scientists and researchers because the time and length scales of biological systems have now become equivalent to the times and length scales that we can design nanotechnology and engineer nanotechnology on. For instance, if we look at enzymes such as ATP synthase, we're looking at systems that are on the order of a few nanometers. And these systems operate on timescales that involve a few seconds or sub-second interactions and actions. And it's a very interesting time because we can now build artificial versions of molecules and structures that can operate in the same way that we see a lot of systems in life operating at. And to me, it's very exciting, and I hope I can perhaps introduce a few new concepts and new areas of research that you guys find interesting. The three topics that I would like to go into would be medication administration, medical implants, and precision targeting using nanotechnology. In the realm of medical administration, if you go to a pharmaceutical company today and look at where a lot of the R&D budget goes, you'll find a lot goes into pharmacokinetics and pharmacodynamics. Those fields, those departments investigate how do you control the release of your active ingredient in such a way that you do not exceed the toxic level of whatever product or active ingredient you need to have a therapeutic effect. And if we look at, so take for instance, the consumption of a Tylenol. Over time, your body is metabolizing it in the bloodstream. The Tylenol has timed release such that not all of it is immediately absorbed into your bloodstream. Otherwise, we could realize some toxic effects, particularly in the liver. Consequently, a lot of energy and effort goes into how do you design capsules in such a way that we can precisely control for all kinds of patients the release of medications. And nanotechnology is particularly interesting because we can control and engineer the outermost layers of pills to degrade at certain rates and release product at certain rates, which is a very useful feature to have, especially when trying to get FDA approval. So it is a key area of research in universities and pharmaceutical firms right now. Another area that nanotechnology is playing a big role in, has the potential to play a big role in, is medical implants. If we look at people who need to have artificial hips implanted, currently if you had surgery, the artificial hip would have no coating on it, and we also run the risk of having infectious bacteria present as soon as it's exposed to the external environment. The cool thing that nanotechnology will allow us to do in the field of medical implants is control exactly what is on the surface of artificial hips, artificial knees, all these other medical devices, such that we can reduce immunogenicity, the immune response. So when you hear stories of some people having a hard time after they've had a hip replacement, for example, it's because the immune system recognizes that the new hip is a foreign object and or they interact with the infectious bacteria on the surface, and we generate immune responses that can sometimes be fatal. So nanotechnology is cool because we may be able to reduce the number of bacteria on the surface and promote the specific proteins that will allow the body to like the external or the new hip or whatever a lot more than it does in some bad cases. And the way we do that is via a technique referred to as layer by layer thin film coating, which I'll get to in a few minutes. And then the final area I'd like to talk about is precise targeting. And precise targeting is another interesting area, particularly in the field of oncology, where we want to target cancerous tumor cells and avoid damaging healthy tissues. So the current state of affairs in that realm is, if we look at chemotherapy, we don't need to have a systemic therapy. We can instead design our molecules to deposit and interact only with the tumors such that we avoid a lot of the negative side effects and increase the efficacy of our treatments. So that is also a very interesting field that I'll get to in a bit. So the first question to address is, how do you actually build these nanoparticles? And building nanoparticles has actually been fairly common in the past few decades. If we go to Silicon Valley and look at Intel and how they make the CPUs, they've followed something referred to as a top-down engineering approach to the manufacture of such systems. And the way they do that is they take a big silicon wafer, they etch it with UV light and other mechanisms to get a very precise structure of circuitry at the nanoscale. And this is a very good approach if we need high throughput. Intel needs to be able to build thousands of CPUs every day, every week. So top-down approach in various sectors has been used and is used commercially today. The other type of nano manufacturing is something referred to as a bottom-up approach. And bottom-up approach is a very interesting field because it closely resembles protein folding. I think of it like artificial protein folding. The problem with bottom-up approach, though, is that we still do not understand a lot of the mechanisms that are occurring, and it is also a very slow process, especially if we haven't optimized our systems for self-assembly is one example for the bottom-up approaches. So this is a interesting area of research that a lot of people are looking into right now, particularly because it has some very cool impacts and can make very interesting strides in the field of medicine. So to give an example of the precision targeting that is available with nanotechnology, we can examine paclitaxel, abbreviated PTX, and cyclodextrin, abbreviated CD. Paclitaxel is the active ingredient that is a very common anti-tumor medication. So it will kill cancerous cells in your body. The problem with paclitaxel is that it is a very nonpolar substance. Consequently, when it's in your bloodstream, it has a very hard time being transported, and because of that, it is very common to find paclitaxel complexed with a molecule called cyclodextrin. So what cyclodextrin does is it will bind to the paclitaxel in such a way that the overall molecule is now hydrophilic enough to interact favorably with the circulatory system in such a way that it can exist for long enough in your bloodstream to locate and target cancer cells. Now, we apply nanotechnology, specifically nanoassembly, in with these two common oncology medications by having them, excuse me, by taking a form of polymerized paclitaxel and polymerized cyclodextrin and having them complex in the bloodstream via self-assembly to form a molecule, a larger molecule, that will have a long enough lifespan in the blood to locate cancerous cells as well as effectively perform a process referred to as apoptosis once the molecule has reached its target. So once the complex, the nano-assembled, self-assembled complex of PTX and CD has located a tumor in your body, it will infuse via a process such as phagocytosis into the cytosol of the cancer cell, and then it will undergo a process of apoptosis in which it will release its cargo. Its cargo is the paclitaxel. Once paclitaxel is in the cytosol, it can do its job of killing the cancer cells. And this is why this is a cool area of research, particularly in oncology. In the field of medical implants, we can perform techniques such as layer by layer thin film coating. And this is a very important area of research because the current state of medicine involves we cannot control what is on the surface of medical implants and biosensors. So people with diabetes who need to monitor their blood sugar levels periodically or frequently, the introduced nanosensors have had difficult times being effective in that case, and that's the reason why you still see people with diabetes having to prick their fingers every hour or so, especially before and after meals. So layer by layer thin film coating can be a promising topic to study for us to design more effective biosensors and medical implants later on. And I'll conclude by talking about why we don't see more nanotechnology in medicine today and what needs to happen for us to get to where we want to be in the future. And the biggest obstacle we face right now is metrology, the study of measurement. And the problem is when we are designing things at the nanoscale, we are working with individual atoms and very, very small molecules. The techniques we've used previously to image such systems are not fast enough for us to observe what occurs at the nanoscale as it's happening. A good example of this would be atomic force microscopy. Atomic force microscopy involves dragging a hammer across a surface, and as the hammer is deflected by the presence of objects in the z-axis, it deflects a laser that will produce a very detailed 3D image of the surface of the object you want to study. The problem with that is you have to run the hammer over it, and this takes time. And as you're running the hammer over the object you want to study, the nanoassembly and these sub-second processes have already occurred. So that is why we see delays in the state of nanotechnology in medicine, is we've had a very hard time of actually studying what's going on. We're essentially blind until we have better imaging techniques. So if we had better imaging techniques that let us view in real time what was happening at the atomic level, we could draw far better conclusions between why these systems interact the way they do and how we can introduce other variables to control and self-assembly processes. So that is one area that we need to improve on before we can move forward with better nanotechnology. And then the other point that I'd like to highlight here is while we have seen improvements in the stability of drug delivery, it's still not quite good enough. And so drug delivery is there's two things we need to balance when designing an effective drug delivery mechanism. It needs to be stable while it's in the circulatory system. If we had an anti-tumor medication like paclitaxel that was released because it was unstable in the circulatory system, we have just exposed healthy cells to toxic levels of a medication, which can have adverse side effects, potentially fatal. The other problem, so the other side of the drug delivery mechanism that we need to account for is how, once the nanoparticle has reached its target, once the cyclodextrin paclitaxel complex has infused into the cytosol, we need it to dissociate into paclitaxel and cyclodextrin. And it's difficult to do this because you can focus a lot on how do you keep something stable in the circulatory system, but once it actually reaches its target, if it doesn't dissociate, it's not in its active form and it can't do anything. So this is another area where we've seen the potential to have effective medication, but there's still a long road to go before we actually can realize therapeutic effects that we need to have effective oncology medications. So thanks for watching. Let me know if you have any questions, and thank you.